For the latest, let's check in with multimedia correspondent Sam Jo, who's at TTSH. Sam Jo, you've been there since the early afternoon. What have you observed?
Well, Jan, as you can see behind me, and it's been like that the entire day. It's very, very quiet here. That's something that we have noticed. That's something that patients and staff of the hospital have also been saying. Like, usually queues would be a little bit longer. They would have to wait a little longer to get in or to see the doctors. But most of them were in and out within the hour today because of the lower footfall. Even inside the main atrium of the hospital, it's very empty. Outlets such as Toast Box within the hospital is closed. It was closed since yesterday till further notice. A notice was put up on the shutter of the Toast Box shutter, saying that the situation seems to be taking a turn. So in the interest of its customers, Toast Box is closing. There were also some outpatient clinics such as the cardiac center that were not open today. And because of that, generally the mood has been very one of heightened caution, and it's been very, very hush-hush here today in general. The food court here at Tan Tock Seng Hospital as well is pretty much a lot emptier. Usually during the lunch peak hour, there would be a lot of patrons, staff and patients and visitors included, all sitting down and, enjoying the meal. Today, not only were there fewer people there, a lot of them chose to take away their food instead of sitting down and eating their food there and dining in. Some patients that we managed to speak to as well said that, instead of the regular doctors, the doctors that saw them today were substitute doctors because some of their regular doctors, had to have to be quarantined at home. And even during the declaration and registration process, they were asked a lot more questions, such as, whether they had been to Ward 9 of Tan Tock Seng Hospital in the past week. So that's generally, the mood. And it's been generally quiet here at Tan Tock Seng Hospital. Now, I also spoke to some other patients to understand, what the process was like for them today and whether or not they feel worried about the situation. And here is what they have to say. Take a look.
We come here for appointment with the doctor, and very quiet, completely quiet, no one else. Last time easily 30, 40 people, but now you can see 1-2 people in, maybe less than 10.
There's lesser people there, it's not crowded, and then, I think it's okay, it's pretty safe. To me, I feel very, very safe. I trust the hospital will do the necessary control, and I think they have the crowd control very well. I have a very smooth flow getting to the clinic. They actually ask me which clinic I'm going to, what am I here for, so they actually check to make sure that I'm not going to the ward or anything else. I wear my mask, clean my hand, I don't touch my eyes and things like that. So I feel that as long as I follow the guideline, I should be quite okay.
I don't think there's anything to worry about because everything is at the moment is under control. Otherwise they won't call you back in the first place. If it's not safe, they won't call you back. It's all the same. They are very cooperative. The staff are very cooperative. Yeah, they are very nice to you, and I think it's okay. I'm quite satisfied. I'm happy with the service.
Managed to speak to some staff of the hospital. For instance, a nurse who works at the National Center for Infectious Diseases, and she shared that even the staff there have been briefed and have been instructed to take extra precautions. For instance, the tea room in which they usually have their breaks and have their snacks. Now only one person is allowed at a time in that room from now on. So as you can see, a lot of extra precautions and much fewer footfall here today at Tan Tock Seng Hospital. Back to you guys in the studio.
Right. Well, Sam Jo, of course, that is the situation going on at Tan Tock Seng Hospital. Now, yesterday, the Health Ministry said hospitals will help take on the extra load from TTSH. We understand you've been in touch as well with our colleagues who are at the other public hospitals. Are they finding more people there?
Right, so indeed, Olivia, earlier today we also had our colleagues fan out across the different hospitals. We had colleagues at Sengkang General Hospital, Singapore General Hospital, as well as National University Hospital. In terms of footfall, they didn't notice much difference. It was still busy as usual, according to patients and visitors that they spoke to. Although at Sengkang General Hospital, a visitor advisory was put up across the hospital. basically saying that visitors, who have worked in or admitted to or visited Tan Tock Seng Hospital wards on or after 18th of April are not allowed entry into Sengkang General Hospital. And over at Singapore General Hospital, the food court now has a no dine-in sign. So that means that staff and customers, really, anyone who wants to eat there, will not be allowed to dine in. They have to take away their food in order to reduce cross-interaction with visitors. That's what the sign said. The sign also specified that dining in would be the no dining in rule is something that they're encouraging. And if they choose to dine in, they will be limited to 4 people a table. But for some tables, according to our colleague Cheryl, who was there, she noticed that for some tables, 4 per table isn't even an option because they removed the chairs for these tables, So definitely you can tell that the other hospitals are also stepping up in, when it comes to their precautions. Now over at the National University Hospital, it's busy as usual. There doesn't seem to be any hold-up. There doesn't seem to be. They don't seem to be overloaded with more patients or anything. At least not just yet. But they are taking more precautions. The same way, registration has been taking a longer time here at Tan Tock Seng Hospital. Over at NUH, they've been asking everyone if they've been to Tan Tock Seng Hospital in the past week. They're asking more questions in relation to Singapore's first hospital cluster. So in general, the mood at all the hospitals, including Tan Tock Seng Hospital, seems to be one of heightened caution, but also confidence that the situation is pretty much under control.